This morning, you probably woke up, walked into your child's room, picked their shoe up off the floor, and slipped it onto their foot. Maybe without even looking inside, your mind already on the day ahead. It's a completely ordinary moment. It happens in millions of homes every single day. And that's exactly the moment I need you to rethink today. Because there's a threat the vast majority of parents have never considered. Not because they're careless, but because no one ever stopped to explain it properly. Stay with me until the end of this video. In the last 9 minutes, I'm going to show you a simple tool, one that costs less than $10, that can reveal whether there's a scorpion in your home right now before your child finds it first. Scorpions. Most parents hear that word and picture a desert. They picture a hiking trail, a campsite, somewhere far from home. That's the mistake. That's the mistake that puts children at risk every year. Inside ordinary homes in ordinary neighborhoods, in cities where no one expects to find this animal, scorpions don't break into homes like intruders forcing their way in. They simply walk in, through gaps under doors, through cracks in baseboards, through cardboard boxes. That delivery that arrived yesterday, the moving box still sitting in the spare room. They follow moisture, warmth, and insects. Everything a home has to offer. And once they're inside, they don't move much. They stay. They can stay for months without eating, without appearing, without giving any sign that they're there. They can go an entire year without needing food. They are patient in a way no other animal in your home is. And where do they stay? In the exact places children's hands go without thinking. Inside shoes, inside folded towels, in the dark corner of the closet, under the bed, behind the bathroom door, not in exotic or hard-to-reach places, in the most ordinary spots in your home. If you're thinking right now, but I've never seen a scorpion here, that doesn't mean there isn't one. It means you haven't found it yet. They're nocturnal. They move while you sleep. They stay still when there's light. A scorpion can share your home with you for months and never be seen, until the moment a child's hand gets close. So the first thing you need to understand is what draws a scorpion into your home and what keeps it there. They don't come in by chance. They come in because your home offers 3 things they need: shelter, warmth, and food. The shelter is the gaps, the dark corners, the tight spaces where no light reaches. The warmth is the structure of the house itself, and the food is other insects. Cockroaches, crickets, small spiders. If your home has any of these, it's a viable environment for a scorpion. Controlling smaller pests isn't just about cleanliness. It's a real barrier against scorpions. But let's be direct, even a clean home with no visible pests can have a scorpion, because they don't need to eat often. They can come in, settle into a corner, and stay there without feeding for weeks. Their presence doesn't depend on an insect infestation. All it takes is a poorly sealed door, a crack in a baseboard, a cardboard box brought in from outside. If you're not subscribed to the channel yet, this is the kind of information we bring you every week and the things medicine knows that parents need to know too. Subscribe. It's free, and it can make a real difference. Now, about what to do when you find one. Because this is a moment when a lot of parents make the wrong decision on impulse. The first instinct is to kill it. And I completely understand. But killing a scorpion with your hand, with a thin cloth, or by trying to crush it with some improvised object, puts you at direct risk. A cornered scorpion is a scorpion that strikes back. The right way is to use a rigid, long object to contain it. A pair of long tongs, a glass jar turned over it, then sliding a stiff surface underneath to capture it safely. If you choose to kill it, use a heavy object and keep your distance. Never with bare hands and never in a hurry. Now about household insecticides. This is a question parents ask a lot, and the answer is more complex than it seems. Common products have limited effect on scorpions because their bodies have a thick cuticle that reduces absorption through contact. What works best is perimeter control done by a professional. Targeted products applied to gaps, baseboards, and entry points, combined with physically sealing those entrances. Sealing is more effective than any chemical on its own. A weather seal under exterior doors, caulking cracks in baseboards, screens on drains and windows. These physical measures block the way in before any product even needs to act. All of this, the sealing, the caution with boxes, the habit with shoes, exists for one simple reason. If an encounter happens, the time you have to react is short. And in a small child, it's even shorter than you imagine. What comes next is what you need to know to act correctly in that moment. A scorpion's venom acts on the nervous system. It interferes directly with the electrical signals that control muscles, breathing, and heart rate. In an adult, the body has reserves and mechanisms to compensate for that attack. In a small child, especially under the age of 5, that margin doesn't exist. The same sting that causes intense pain in an adult can trigger a systemic crisis in a child in under an hour. This isn't an exaggeration, it's biology. That's why the signs matter so much, and that's why you need to know them now, not in the moment you need them. The first sign is the simplest and the easiest to mistake for something else. Sudden, intense crying with no apparent cause. The child was fine. Within seconds, they're in distress. It's not a tantrum. It's not tiredness. It's immediate pain they can't name. If this happens and you don't have a clear explanation for the crying, look right away for a small mark on the skin, on the feet, the hands, the fingers. The sting site rarely bleeds. It may look like nothing more than a tiny red pinprick. The second sign is excessive, uncontrollable drooling. The child starts to drool abnormally without a fever, without nausea from any other obvious cause. This happens because the venom affects the autonomic nervous system, the part of the nervous system that controls the functions the body carries out on its own, like saliva production, heart rate, and breathing. When that system is disturbed, the body visibly loses control of those functions. The third sign is specific to scorpion stings in children and almost never appears in other situations. Rapid, involuntary eye movements. The eyes darting from side to side without control. If you see this in a child, go to the emergency room immediately. Don't wait for any other sign. This one is enough. Other signs that call for immediate action: muscle spasms or arching of the body with no clear cause, rapid and shallow breathing, sudden vomiting combined with intense agitation, and in more severe cases, muscle limpness. When a child who had been crying suddenly goes slack, with no muscle tone. That last sign means the nervous system is being seriously overwhelmed. I need to be direct here. If any of these signs appear after a suspected sting, the destination is the hospital emergency room, not the pharmacy, not waiting to see how it develops, not calling a relative to ask what to do. It's the emergency room. The time between recognizing the symptoms and getting medical care is the single biggest factor in the outcome for young children. Tell me in the comments, did you know scorpions could be inside your home before watching this video? I want to know where you're watching this from. Now, about what to do and what not to do. Because in this moment, there's a list of mistakes parents make on instinct that only make things worse. Don't put anything on the sting site. No ice, no toothpaste, no plant leaves, no tourniquet. These measures don't neutralize the venom and can make medical assessment harder. The venom is already circulating. Cutting off local circulation solves nothing and can cause additional tissue damage. Don't give any medication on your own before medical care. No antihistamine, no painkiller, nothing. The doctor needs to assess the child without pharmacological interference to make the right decisions about treatment. What you should do: keep the child calm and still. Intense movement speeds up the venom's circulation. Call poison control while you're on your way to the emergency room. In the United States, the number is 1-800-222-1222. If you're not in the United States, save your country's poison control number now, before you ever need it. And if you were able to identify or photograph the scorpion, tell the doctor. It can directly influence the treatment protocol. And if you found a scorpion in your home but no one was stung, don't ignore it. A scorpion inside your home is evidence that an entry route exists. There may be others. Call a pest control professional with specific experience in scorpions and review all the entry points we talked about earlier. One occurrence is a warning. Treat it as one. If this video was useful to you, takes 1 second and helps other parents find this information. It makes a real difference. Now we've reached the part I promised from the very beginning. The most effective tool there is for knowing whether there's a scorpion in your home right now, and it costs less than $10. Scorpions are fluorescent under ultraviolet light. With a black light and a simple UV flashlight you can find in any online store, you turn off the lights in your house at night and sweep along the baseboards, the corners of the bedrooms, the bathroom, the laundry area, the inside of low cabinets. Any scorpion present will glow blue-green, instantly visible, impossible to mistake. It's the same method pest control professionals use, and almost no parent knows they can do it themselves this week at no cost at all. After the sweep, no matter the result, you already know what to do. Seal the gaps under exterior doors, caulk the cracks in baseboards, put screens on drains, inspect cardboard boxes before bringing them inside, and shake out shoes before slipping them onto your child's feet. Every time, without exception, as a rule of the house. You don't need to be afraid of scorpions. You need to know them better than they know you, and now you do. An informed parent isn't an anxious parent. An informed parent is a prepared one, and preparation is the only real form of protection there is. Thanks for watching, and take care of your little ones.